We're going to go ahead and jump right into RSV. So I'm going to go over the basic definition on RSV. So we're talking about the respiratory cylindrical virus, or RSV, causes an illness that is usually similar to a moderate to severe cold and is very contagious. RSV most often resolves on its own about 10 to 14 days and does not cause major health concerns, but can become a problem when it is severe or leads to other complications. Premature babies and patients with immune problems or heart and lung problems may be at risk. It is highly contagious, spreading via secretion, saliva, or mucus. When the patient coughs, sneezes, or talks. Two main types of RSV exist, and patients cannot develop, I'm going to repeat that, patients cannot develop full immunity to the virus. The infection affects the nose, throat, and upper respiratory system, often exhibiting symptoms similar to pneumonia, croup, and laryngeal tracheal bronchitis, or bronchiolitis. Symptoms include mild sore throat, cough, stuffy or runny nose, earache, and fever, possibly difficulty breathing as well. Although no treatments for RSV is available, secondary bacterial infections may be treated with antibiotics, and fluids will prevent dehydration. So the people that are usually at a high risk are anybody who is immunocompromised. Okay, so let's talk about immunocompromised really quick. If somebody has a cold, are they immunocompromised? Yes. If they have a fever, they're immunocompromised. Yes. If they have let's say they have double lung pneumonia or single lung pneumonia, yes, of course. If they're sick, yes, they are immunocompromised. If they have a lung or heart disease that has literally been that's specifically been diagnosed, and of course that person is immunocompromised. Immunocompromisation is where the body can't fight or has a hard time fighting other illnesses when it's trying to fight a certain battle currently inside the body. That's when you're immunocompromised. When all your cells are trying to attack that one thing and then something else is introduced, could actually cause and exacerbate the problem quite significantly. A lot of people who are, especially people that are ages 55 and up, are prone to this, especially younger children as well. So we can look at the whole range of people as from people just born to all the way up to geriatrics. So RSV is transmitted through mucus, sneezing, and it can even be transmitted through by just talking, coughing, talking, sneezing. Usually it happens in the nasal passages. So anybody who kind of comes within close contact with or proximity of a person that is showing signs of sickness should be staying away for at least 6 feet. Usually it's 3 feet, but we like the 6 feet rule better, actually, because you're further away. If you have to be in close proximity with somebody, best thing to do, carry a mask. Keep a simple isolation, wash hands when necessary, and if you can't go to a sink, then use simple, hand sanitizers, anything like that will work until you get to a sink.